your heart needs a little help, certain devices can deliver the appropriate assistance. Dr. Mohammed Hajiri is here to share why a shock to the heart can be healthy. Dr. Hajiri is with the Heart and Vascular Center at MetroHealth. Welcome to the show.
Thank you very much, Lori.
So we're going to talk about a number of devices that are battery powered or use electricity to help out your heart, right?
Absolutely. So the way I look at it is that the heart can either go too fast or too slow. And it's like basically a two-floor house with an elevator in that has electricity and has plumbing and has rooms. So when the plumbing has a problem, that's when people have a heart attack and they need a stent and all that. But when the electricity of the house has a problem, this is when you would need a pacemaker. Okay. So if the heart becomes very slow, what the pacemaker does is that it substitutes what the electrical engine in the heart that keeps it going, it substitutes for it and delivers the electricity to the heart. So this is a pacemaker that we implant with a very small incision under the skin. And then from it, there's a wire that extends all the way to the heart and delivers electricity that keeps the heart moving. This pacemaker, implanting it takes about 40 minutes.
So
40
not
minutes
too
to
bad.
1 hour. Not too bad.
So how would you know when you'd need the pacemaker as opposed to something different?
So oftentimes patients feel dizzy, they feel tired, they just feel not together. And as we grow older, the electricity in the heart starts getting calcium and starts not working very well. So what happens is oftentimes, especially elder patients, they may fall, they may come to the emergency department with a fracture in their hip, and then we realize that the electricity in the heart is not working.
Okay.
Very commonly, they can have dizziness, lightheadedness, and symptoms like this. Sometimes very fast heart rate, and then they lose consciousness afterwards.
Oof. So the other type of device is called a defibrillator.
Absolutely.
So when is that necessary?
Right. So that is when the heart goes crazy and becomes very fast.
Okay.
And I always give my patients the analogy is that this is like having crazy man who lives in your heart. And keeps on hitting on your heart really fast. Now, the heart cannot take very fast heart rates. And what happens is that when it's very fast, it does not fill with enough blood. So patients can also lose consciousness. This is more common with patients with heart failure, where their heart is not as strong as it's supposed to be.
Okay.
This is the defibrillator. It's a little larger than the pacemaker. We also implant it here, and then the wires go in to the heart. And when the patient has a very fast heart rate, this device delivers a shock where it brings the heart back to its normal rhythm again.
Kicks it back into pace.
Kicks it back into pace.
All right, so those are some things to correct problems. What if you're trying to track what is the problem?
That is a very excellent question. So what is the problem? Sometimes patients come to us with palpitations, or they lost consciousness and they don't know what's going on, or more importantly with a stroke, and we don't know what's the cause of the stroke. Now, one of the very important causes of strokes are atrial fibrillation or irregular heartbeat. Sometimes this cannot be caught, and if we cannot catch the cause, so we can't treat it, and patients can get strokes again. Okay. So we have this device that's relatively new, where this takes about 10 seconds to implant. It's literally a chip. I tell my patients this is a chip. It's not a pacemaker. It's not a defibrillator. It's with a needle. We implant it here, and it has a battery in it that is good for about 2 years, where it constantly monitors your heart and tells us if you have irregular heartbeat. It tells us the cause of the stroke, it tells us the cause of your palpitations or any of those things if we cannot catch it with regular Holter monitor or things like that.
And then we can fix it. So.
And then we can fix it, absolutely.
If your heart's current isn't correct, there are devices whose job it is to jolt them back to their best beat. If you need more help with your heart, use the information that's coming up next. My thanks to Dr. Hajiri for this shockingly important information.
Thank you very much.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org. Next.